Thank you. And thanks for reminding me. So that being said, as we're recording this, so those people who aren't here tonight are going to be able to handle this. I feel like we have some of the most experienced team of IBM therapists that will be talking to us tonight. For those of you who are patients at Johns Hopkins, you both know, I hope you know, both Ruben and Finn. Ruben has his doctorate in physical therapy and has been dealing with the myositis clinic at Johns Hopkins since 2014. Finn also is a clinical coordinator for the Johns Hopkins Bayview Physical Therapy Rehabilitation Services, and also is very involved with myositis patients. We're also honored to have Allison Fisher, who is an occupational therapist working again with the myositis clinic and working in the rehab services at Johns Hopkins Bayview. Allison's specialty that you may not hear as much about tonight, but you will on the next meeting, is on equipment and to be used for myositis. So that being said, I am so excited that we have this team of experts to help us and educate us on our myositis journey. And with that, I'm going to turn it over to Ruben, Finn, and Allison. Ruben, Finn.
Mm-hmm. Yes. You can move to the next slide, please. Next slide. To the yep.
Yeah. So I mean, basically, well, first off, thank you everybody who's out there, and I certainly hope we can give you some information that's helpful in any way. But just to kind of for starters, just a little disclaimer. We have all been working, all three of us, with the myositis population for quite a while now and pretty intensively. But the information that's given tonight, this is it's general information, so it's not a substitute for any particular or individual care that you might be getting. And, you know, it doesn't take the place of visits with your own personal physicians, physical therapists, and occupational physicians, therapists. Also, it's just that, you know, we're basing all this on our experience that we've had, and it's not really something that's necessarily endorsed by the Johns Hopkins Medical Institute or the Johns Hopkins Myositis Center. It's just based on all of the knowledge from the patients we've been treating for the past number of years. Okay, and we can move on now. Slide. Next slide.
Good evening, everyone. I'm Ruben. I've been working here in the myositis for the past 14 years. And I'm really happy to spend this time with you guys to educate you guys with fall preventions in IBM. So in inclusion body myositis, what are the most common causes of falls? Next slide, please. So these are the most common causes of falls that we hear from the patients that come here in the myositis clinic. If you look at these reports from the patients, you would, you know, the majority of them is from knee buckling. You know, they say, oh, my knee buckles when I walk, you know, unexpectedly. Or when I was going upstairs or going downstairs or going down a curve, my knee will buckle. The second most common cause that our patients tell us is from causing of falls is tripping on their foot. So they're walking on the street and then suddenly the left foot will trip over some uneven surface on the ground, and then they fall, they lost their balance. Another cause of falls is fatigue. Their muscle gets fatigued easily, but they feel the fatigue, but they keep going, they don't stop. And then it comes to the point where the muscle cannot, hold their weight, and then slight unevenness in the ground will, make them lose their balance, and the muscle cannot help them anymore because it's very fatigued, and then they fall. Or another complaint is, I would think, is lack of confidence, especially on crowded places. So they'll tell us like, oh, I was in a crowded place in the airport, and someone just bumped me slightly, and then I begin to lose my balance, and I couldn't catch myself, and then I end up falling. So so those are the typical things that most of these patients tell us. So next slide, please. So I just want to give you guys some like a brief overview. Why is IBM patient at risk of falling? Why do IBM patients fall? So I think it's important for us to tell you what are the clinical features of this disease that makes a person with IBM at risk of falls. So IBM is as you all know, it's a slowly progressive muscle disease characterized by muscle inflammation, weakness, and muscle wasting or muscle atrophy. It preferentially, or it targets specifically the distal muscle groups, which are the muscle groups that are away from your core, which are your forearm muscles, your hands, your thigh muscles, and your foot muscles. It may also affect the proximal muscle, which are the muscles like the shoulders and the hips, but not much. But the muscle group that are most affected by IBM are primarily the finger flexors, the knee extensors, the quadriceps, and the muscle in the lower leg called the ankle dorsiflexors, or the muscle that allows or keep your foot up when you walk, so that your foot won't trip. And because of this involvement of this muscle group, which is called the anti-gravity muscles, this anti-gravity muscle that holds your posture up, and that's the main causes of fall in IBM, the muscle weakness. Next slide, please. So as I said in the previous slide, IBM preferentially affect the quadricep muscle. This is the muscle in the front of your thigh that extends your leg or keep your knee extended and keep you upright when you walk, when you stand, or help you when you stand up. And in IBM, there's a progressive weakening of this muscle. And as you can imagine, if you have weakness on this muscle, this can cause knee buckling when you move. It can also cause difficulty arising from a seated position, more so when it's a lower chair. And then it can also cause like imbalance issues or balance issues, especially when you walk on uneven surfaces, because the knee can buckle at any time, or it can cause you to feel like a little wobbly. More so if you are going up and down stairs or negotiating curbs. Next slide, please. Another muscle group that are affected by IBM is the ankle dorsiflexors, which are the muscle in the lower part of your leg on the shin area. The function of this muscle is to flex your foot towards your shin, which allows you to not trip whenever you walk. So you can imagine that when this muscle is weak, you can end up tripping and falling, and because the foot can catch on the ground, and it can cause you to lose your balance and fall. Or if it's not weak enough, it can make you feel wobbly on your feet and ankles, especially walking on the grass or uneven surfaces, which makes someone be like, oh, I don't have confidence like on crowded places. Now, I'm not saying that only for the ankle, but also a combination with your quadricep weakness. Those overall muscle weakness can cause you to feel wobbly. And now these clinical features of IBM the impaired muscle endurance stems from the fact that you have a progressive muscle weakness, which causes the muscle to fatigue easily. And as your muscle fatigue easily, it can cause frequent knee buckling or tripping on your foot, which can cause you to fall. And because in IBM, it is a progressive muscle weakness, people tends to not move as much because they're afraid of falling. And because of not moving much, it can cause debility or deconditioning, and that can cause reduced aerobic capacity or reduce overall fitness, which makes someone at risk of falling. Next slide, please. So, so what exercises would be good to complete to prevent falls?
Okay, so hi, thank you for that. So the problem you run into talking about like maybe what are the best exercises with, a large group of people who have inclusion body myositis is the incredible range of debility, from people who are just diagnosed, who are in the beginning, to people who have had it for quite a while and have an advanced disease. But there are a few things that you have to keep in mind. And I think, one of the things is, like Ruben was just talking about, there are the very specific muscles that are the diseased muscles that you have to try to keep up with as best you can, even if it feels like a downhill slope. But in addition to that, there are all the supporting muscles. And, when you think about something like the weakness in the quadriceps, well, really, when you're talking about somebody who trips or starts to lose their balance, even though what you might be feeling is my knees buckling, what the body really relies on are the hips and the ankles to try to always right itself when somebody starts to have a fall. So in addition to trying to do some exercises targeting the weaker muscles, you want to also be targeting all the supporting muscles. Kind of on top of that, like Ruben was saying, it is basically a disease of muscular endurance, and anything that you can do that improves the endurance of those muscles, not just the strength, but you tend to lose the strength because you have no endurance, so you use the muscle less and they get weaker. Whether it's doing the aerobic exercising, which we say everybody should be doing some form of aerobic exercise. Also, when it comes to doing the individual exercises for muscles, regardless of the complexity of that exercise, it's important to do a lot of repetitions. Okay, that's more important than working with a lot of resistance or anything like that. And then I think the last thing, just in general terms, is just making sure that you're doing some balance exercises. And it's fine to have a strong muscle, but you also have to have that neuromuscular connection that allows you to act as quick as you can. You don't want a muscle that's just strong, but one that knows when to kick itself in to try to keep you off of the ground. So balance exercises, targeted exercises, generalized exercises, and then working on the muscular endurance are all important things to pull together. And we can go to the next slide here for this. So, again, when you talk about the hips helping you, you need strong hip flexors, the ones that bend up your leg. You need really strong hip extensors that will straighten out the leg. And not included on this slide are those the abductors, which are on the outside of your thighs, and the adductors, which are on the inside of your thighs, because those are all going to be the muscles that try to grab you and hold on. Additionally, just a strong core is really going to to help stabilize you. If you start to lose your balance. So can we go to the next slide there? So this is just kind of a list, just some examples of some exercises that we like to give to people. And, you know, if you look at the top left, the transverse abdominis activation, that can range all the way from like this lady lying with just in a hook lying position. And what you're trying to do is really basically keep your back kind of glued to the floor while you can start to maybe march with your feet without your back arching up at all. So if you have an extremely weak core, you're getting in that position and all you're doing is letting your legs drop out to the side and pull back in, drop out to the side and pull back in. You get a little stronger, you can start to march. You get a little stronger, you can be lifting both legs at once. And if you get even stronger than that, you can progress to the far right of the screen where we call it a dead bug. It doesn't really look like a dead bug. It looks like a live bug to me that's stuck on its back. But where you keep your shoulders, your hips glued to the floor while you're slowly moving your arms and legs in opposite fashion. Okay, and so the arms and legs are kind of acting as a weight, and the strengthening that's going on is you keeping your shoulders and your hips just glued to the floor. The second exercise on the top left, bridging. Bridging gives you a huge bang for your buck because you're both can exercise the gluteal muscles and the hamstrings, but also if you think about it as an exercise where you're not just lifting your hips right up off of the ground and back down. If you think of it as like, I'm going to roll my back up and I'm going to roll my back down, you'll feel that it very much works the rest of your core. So slow, steady bridging, taking about 3 to 5 seconds. You don't have to hold it when you get up there. But up and down is going to be a really helpful one. I think that I saw one comment in there about doing these. How can you do these on the floor? Sorry, we have some noise in our background. You know, all these things, ideally they're done with a firmer surface, but they can all be done on the bed, these things like this. You know, sometimes for people who find their beds too soft, if you just go to some place like a Home Depot or a Staples or something like that, you can get just one of those plastic boards that you put underneath an office chair. I don't know exactly what you call them, but you can put that on the bed, put the sheet on top of it, and it gives you a much firmer surface on your bed to do these things. The straight leg raises, which is in the top, in the middle. You know, again, that's just kind of working those hip flexors. I think Ruben gets into it later in here. I know he does, with using a metronome to help with some of these exercises. It's important that you're not rushing them, doing them too quick, letting momentum do the work for you, but that you're forcing the muscles to do it on their own. And for that, we frequently, people who have been here to see us, you know that we like to do stuff with a metronome and trying to make you guys keep up with the beat of the metronome. And we'll go into that and I'll tell you just how we like to set the metronome so you get the biggest bang for your buck with that. The clamshell with resistance, the top second to the right one up there, that works those muscles on the outside of your thigh. And this picture shows you with your legs bent and with a resistance band around your thighs, and you're just it's called a clamshell because you're just going to open your knees apart, just like a clam opening up to taking in some nutrition. The point of this one is to keep your trunk perfectly still from your shoulders to your hips, doesn't move at all. And the action is just that upper leg opening up and gently closing down in a controlled fashion. And this is an abductor exercise, not an adductor. I saw somebody ask right up there on the screen, adductor with a question mark. This works is an abductor, so it works the outside of your thighs. I don't know if there's a camera on it. The adductor muscles are on the inside of your thighs.
I mean, you can.
And so if you wanted to, you could take that band off from around your legs and just take that lower leg and straighten it out and try to almost beat it up and down nice and slowly on the mat. And that would work your adductors there. The bottom two on the left, supine lower trunk rotation and quadruped full range thoracic rotation. I think I like these people doing this a lot. You'll see later when we talk about it, the controlled fall as much as you can. These two exercises just help you a lot with your core stability. Actually, the whole bottom row really helps with core strength. So there are plenty of people I know that, especially when you start getting up onto all fours, there's a lot of elbow extensor weakness with IBM. And for some people, supporting themselves on an outstretched arm is a difficult task. What I think makes this a lot easier is if you take one of those gym balls or like Swiss balls that you can buy at a million places, Targets, Walmart, Dick's, whatever, and you could you put those down on the bed, and so you're kind of still getting in that quadruped, but you're holding on to the ball instead of having your arms stretched out. And then you can you don't have to rely so much on your elbow extensors locking your elbows, and you can still get things in there. There was a very good question that this popped up about what about people with a lot of osteoporosis, and you do want to be careful with that. We don't do excessive rotation with that.
For the osteoporosis question.
But yeah. It sounds like Ruben has something in mind to answer that in just a second. So we'll let him get to that. But I do think that if you can do these two bottom right exercises, if you can get yourself doing those in quadruped, you do get a huge bang for your buck. They work on strengthening your elbow extensors. They work on strengthening your shoulder girdle, and they'll work on strengthening the pelvic girdle and the hip extensors, all with just with one motion in there. Okay. So let's go to the next slide. Oh,
yeah.
I thought we had done this one.
Huh?
I thought we had.
Oh, so it is just showing you the what a quadricep muscle is, because the next exercise will explain to you some of the quadricep exercises that we typically give to the IBM patients, just to show you where this muscles is. So next slide, please. So as you all know, quadricep is the primary muscles that are affected by IBM. So these are the typical for so like level 1 exercise that we like the first one, the short arc quads with a ball squeeze, where you put a foam roll, and if squeezing a ball between your thighs is difficult, you can not do that and just just extend your leg and then hold it for like 5-10 seconds. If that's too easy for you, you can add a weights. Now, in terms of adding resistance, if you're able to do it, we typically tell our patients to to find a weight that you can do at most like 15 repetitions or 20 repetitions. So if the weights, let's say I give you 10 pounds and then I ask you to do the short arc quads and you can only do 5, that weight may be too much for you. So you may want to like lower it down and find a weight that you can do at most 15 or 20 repetitions. Same thing with the remaining exercises like the seated long arc quads with hip abduction. The reason why we want to combine the squeeze, the hip abduction, is because it activates more of your quads versus like just doing an isolated knee extension. And just imagine with the squeeze and the weights, it will really give you a good workout on your quads. Another thing I want to point out is after doing this exercise, we just want you to really like take some time to fully recover before engaging yourself in like more strenuous activity, because you're more likely to buckle in your knees if you don't rest. You need to give yourself some time to rest. The sit to stand and the wall quarter squats, these are like closed kinetic chain exercises, meaning like your feet are glued to the ground and your body is like, this is actually you get a lot of things going here, not only your quads but also your hips, your butt muscles when you do the sit to stand or your wall squat. You just don't want to go too far down that you end up buckling your knees. So when you're doing a quarter squat, you want to go to a point where you feel the tension in your quads, but still able to go up, but not too far down. And you may want to hold it there for like 5 seconds or 10 seconds if you can do it. And the exercise guidelines for IBM is low intensity, high repetition type of exercises. And then the last one I have here is the standing terminal knee extension with a ball against the wall. So basically, I don't know if you guys see. Yeah, finish demonstrate. You just have to. There you go. And then you ask the patient to squeeze the ball, and you feel the tension right here. Make sure if you're unsteady, you have something to hold on, because this makes people like unsteady. And just squeeze the ball and hold it for like 5-10 seconds, and then let go. And squeeze again. You'll feel the butt muscle also activating when you do that. So that's a good exercise. I think that's for the quads. So next slide, please. So this is the just anatomy of the ankle dorsiflexor, which is the muscle here in the lower part of your leg, which helps you pick up your feet when you walk to prevent foot drop. And then the next slide, please. So on these slides, I gave you different exercises for the ankle, not only for the ankle dorsiflexors, which I think is very important to be more comprehensive type of exercises. The first one is the seated ankle dorsiflexion with the band, and that's typically is the one for ankle dorsiflexors. You pull it up and you feel the tension in front of your leg, and you hold it there for 5-10 seconds and do as many as you can. The next one is the ankle plantar flexion, which is basically like stepping on a foot brake and hold it there for like 5-10 seconds. And then the seated toe raises. For those people who are unable to use weights, they can do active motion by doing toe raises or heel raises while seated. And then the last one is the gastric stretch. It's important, especially for those people with foot drop, to stretch their calf muscles. If you're unable to do the stretch in standing, what you can do is you can do it laying down, but you can use like a towel and just do some long sitting stretch. Next slide, please.
I will when we do the balance.
Now, this one is called the muscle endurance training. This is what Finn is telling you about, and we'll have to give this to our patient. So, so the muscle endurance training here focuses on the quadriceps in this particular slide. So you have the short arc quads, the long arc quads, and the straight leg raise. So I'm gonna play a metronome here. I typically we typically set it up to like 40 beats a minute. I don't know if you guys hear it. So let's say you're doing the short arc quads. So what you do is you follow the beat of the metronome. So you kick your leg up with a beat, down with the beat. And you perform as many repetitions as you can until you feel muscle fatigue. Or if it's really too much or you're having a lot of pain, you can stop. And you do the same thing with the straight leg raise and the kicking out. I don't know what you.
Yeah. And I think for people, because I know a lot of people have trouble with the weakness. When you are sitting, they can't extend that knee all the way. But this is another one that you can lie on your side on the bed. And as you're lying on your side with your leg curled, you can just kick it forward and bend it back and kick it forward and bend it back. The blur background.
Blur back.
What is
Oh, sorry. Oh, they were not able to see that. Oh, they. I think okay now. Okay, I guess we're fine now.
I hope.
Okay, good.
All right.
Okay.
Boy, I wonder, I don't know how much was missed because of that. I apologize.
I guess
Well, we can do it and then see if
Okay.
they want to.
we can show you the one that you missed, the quadricep exercises. You put like a fix the ball. Ask the patient to put it behind your knee.
You need to tilt the screen down.
Is that good?
That's good.
That's better. Good,
Good.
good.
So hold on to someone and then you push against the ball, you squeeze the ball with your knee and you hold it there for like 5-10 seconds. And you'll feel the tension right here on the quads. You don't want to go do it like this. You want to like stand straight and then really push it down. And you'll feel the tension here. Hold for 5 seconds and let go. And then push back again. And then let go. And you really feel it right here in quads. Next slide, please. So this is like so aerobic exercise in IBM is really important. And you know the benefits of aerobic exercise. You know, it increases your muscles efficiency to extract oxygen so that you can sustain more prolonged activity. Aerobic exercise is good for your heart. You know, there's some studies out there that exercise, especially aerobic exercise, has a anti-inflammatory effect to the muscle, especially in IBM. And also like it increases capillary density, which is the blood vessels, which, you know, increased capillary density means improved circulation of nutrients in the muscle, which increases your muscle's ability to sustain more prolonged activity. So this exercise study in IBM, actually, it's a 7 IBM patients. And what they did is they combined the exercises that we've talked about the hip, the knee, and the ankles, together with cycling, stationary bicycle cycling. And they did this they did the cycling for 30 minutes and up to a load of 80% of VO2 max, which means it's a moderate level aerobic exercise. And they did this 3 times a week for 12 weeks. And then at the end of the 12 weeks, they measured the VO2 max of the patient, the aerobic capacity, and it significantly improved by 38%. So the takeaway from this study is, if combining both resistance and aerobic exercises gives you a lot of benefits, not only for your muscle endurance and overall fitness, but also on the individual muscle strength.
Yeah, and I think always the biggest challenge with this is finding the right venue to do the aerobic exercise. So somebody just said, how helpful is daily walking? Daily walking is great, but again, it should be as much as you feel safe, it should be a purposeful walk. You know, you want to think of, to get the aerobic benefit, that it's not a casual stroll, but it is getting your heart rate up, just, 10, 15 beats a minute, and holding it there at a sustained level. If you can't do that through walking, there is certainly things like the stationary bikes and stuff like that, swimming. There any method you can think of that you enjoy. So you should. Somebody put in another question just about sample sizes, because this was just 7 individuals, and that has been honestly, it's a rare disorder, and when you look at the studies, you're really lucky if you get a sample size of around 30 people. So most of sample sizes in IBM studies do have pretty small sizes, cohorts. Somebody else is just asking, should these exercises be done every day? I think we always, just from a safety point of view, especially when you're working the quadriceps muscles and things like that, I think it's good to give a day off in between exercise sessions, just to make sure there's not, what I always worry about is when you hear patients talk about, the exercise went great, I felt really good doing it, and then I stepped off of the machine, or I got up and I felt my legs were going to collapse on me. So you want to make sure that you have some built-in recovery. Remember, the exercise breaks down the muscle a little bit, and the rest time builds it back up. So I think it's better to have a day off between exercising the same muscles.
You also want to rotate your exercise. You may want to do like every other day of like, let's say your knees and your ankles, and then the other days that you don't do resistance exercise, you may want to do the aerobic exercise, the aerobic component.
Yeah.
So you may want to spread it out. Okay.
Yeah.
Next slide, please.
So next are, again, it's just kind of a reminder that preventing falls doesn't come just from strength, but it also comes from a little bit of practicing some of that neuromuscular, almost reflexive reactions. There are a couple things that I don't have a slide of that I like people doing, but I'll just show you. If we can, so tell us if the camera's not pointed the right way.
Or if we need to get closer.
Yeah. So one simple thing is, which really helps with ankle strength, also in addition to your balance, is practicing single leg stance. And some people are not comfortable just going up on one leg because they don't trust their knee to hold them. So that if you take a ball and stand by a wall or a counter, and if you want to work your right leg and all the muscles around your ankle, you take your left leg up onto that ball, and it's just like you're a soccer player practicing. You start working the ball around and around, and you'll feel it very much in the muscles surrounding this ankle, because as you're moving and shifting that ball, it can go forward, it can go backwards. That ankle is working very hard to maintain your balance. Okay, so you can just do a sweep around, and then just give yourself a break, switch the leg, do it with the other leg. You get just enough feedback from the ball. That it makes it much easier for you to keep your balance. Okay. So I like people doing a lot of that. If they really like it and want it, they can start playing soccer while they hold on to something. Another thing is just to get into a corner of a room, and maybe have a chair in front of you and try not just going up on one leg, but going up on one leg and then rotating a little bit. Twisting your hips just a little bit when you're on one leg. Okay. And when you do that, you don't want to lock your knees and do it. First, you get on one leg and then just see, can I just unlock? And that's where you might have your hands on a countertop. Look, I nearly hands on a countertop or something like that, just for safety's sake. Get comfortable, single leg stance with just a slightly unlocked knee. And if you get to a point where you're comfortable with that, then you can start working on, now can I wiggle my body a little bit over top of that? That both works your ankle a whole lot, but it also works those muscles up in your hip that have to grab you quickly when you start to lose your balance. The last thing I wanted to show you, in the interest of time, is if you take, this is just like about 1.5 inches or close to 2-inch step. And anybody who's seen me here knows I like using that a lot, because you want to promise like practice. Can I get some control over my knee? Hold on to something and let it take your weight. Okay, just practicing those small little steps. And then can I hold on to something and just get some confidence and strength back in that very end range of my knee. Okay. Just switching sides with that one too. I think that's a wonderful exercise if you can still do that, because a lot of times there's such a fear of that my knee's going to buckle immediately, that plays into the fall. And maybe that fear is well founded, but maybe you can start to mitigate the fear a little bit by taking something very controlled and having a small range that you're working on. You can do almost the same thing where you're holding on to a countertop or something and working on little lunges, very little lunges, with the same idea that, can I get myself strong when my knees start to go a little bit? Right? And can I try to get rid of some of that fear factor that might contribute to
Do you
the
know
pulse?
the name of that stuff and where someone can find it?
Oh my gosh, I call it George. No, but we can, if you stay tuned for June, for the July show, we will have that information for you. We have a whole.
And if you and Ruben and on any of these, if anybody has any more questions, send them to womenwithibm@myositis.org, and we will forward them to Finn, Ruben, and Allison. So it's womenwithibm@myositis.org. Guys, I'll send it to you later.
Okay, thank you.
I
That'd be
think
great.
you may have it, you may not.
Yeah,
Okay.
Sorry,
right.
but that's an easy conduit.
Yeah, so there was one question that came across with, when you're doing the thing with the soccer ball, do you do it without the brace or with the brace? I assume the most common brace we see, that we will talk about at a later point too, is not a knee brace, but just those foot ankle orthoses, right? And if you're using that, I would take that off. If ideally you're doing that, the soccer ball barefoot without a brace on, because that's going to allow the muscles to work best. And what people often forget is the inside, the bottom of our feet, there are a lot of small intrinsic muscles that can help us grab the surface and help us keep our balance. And when we're always in shoes or in braces, we're not using those intrinsic muscles, we call them, on our foot. And to exercise a little bit and make those intrinsics work can help with your balance too. Okay, all right,
I think we have to move on.
yeah, let's go ahead and move on
Move
to
on
the
to
next
the
one.
We've
next
got
slide.
plenty of time, guys.
Oh, we have plenty of time?
We've got plenty of time.
Oh, okay.
I saw
Take your time.
she uses a walker for longer distances. Is that okay? I think she was asking if it
Sure.
was. Is it useless to go on daily walks? I would say it's still good to go on. daily
Yeah,
walks.
it's still,
Yeah.
yeah, there's a question about using a walker for walking longer distances. And then is it useless to go on daily walks? I think you can use the walker for daily walks for, whatever you can tolerate, whatever distance you can. You have to use the walker for safety, so just do as much as you can with the walker.
Yeah, I would agree with that. If you're comfortable walking short distances without that walker, you can do almost like little intervals.
Yeah.
Where I'll walk briskly for 30 feet. Now I'm just gonna stop for 5 seconds and I'm gonna walk back and that kind of thing too. Yeah, someone's making the comment that you can just use a small piece of wood, 1 to 2 inches wide. Dollar Tree has wooden pieces.
Oh.
And so it would work. You just want something that's really not more than 2 inches high at the thickest. Because again, this is to help train your muscle when it first might start to bend and you're thinking it's not going to hold me.
Yeah.
Yeah. Is it safer to use the walker on a longer walk or hold
Yeah,
on to
that's
a partner and use a cane? I think holding on to a partner and using a cane can be a wonderful team building
Yeah.
and romance building way of doing it. So I would agree with that.
Okay, I think you're
Yeah, let's
fine.
go.
Let's
go
move on to the next slide.
All right, so in addition to exercises, what are some of the best strategies that we can use to prevent falls as we're going about our day-to-day things and moving about our environment? We can go to the next slide. So one of the ways we can do this is through energy conservation, which is just a fancy way of saying, how can I save my energy throughout the day to avoid becoming over fatigued and potentially putting myself at risk for falls? So when we think back to what we talked about, that we're going to have increased muscle or decreased muscle endurance and that decreased aerobic capacity, it's going to be important that we keep in mind our energy levels throughout the day, because as we get more fatigued, that's going to put us more at risk for falls. So talking about energy conservation, we talk about the 4 Ps. So the first one is planning. Kind of think about what is your day going to be like? Kind of make yourself a to-do list. What do I have to do today? Kind of along the lines of that, prioritizing. What is the most important thing I need to do today? So you want to put that higher up on your list before you run out of steam and before you become too fatigued in order to A, complete that task and B, complete it safely. Pacing, thinking about, could I maybe do this task in 10 minutes, but risk becoming over fatigued and potentially putting myself at risk for falls versus can I give myself 20 minutes to do this task and give myself time to take breaks if I need to, kind of give myself the extra time that I need so I'm not rushing through so I can do it as safely as possible. And then positioning. Do I have everything that I need right in the one place that I need it? Are there things that I can maybe do sitting? Are there ways I can set things up so I'm not bending down, reaching up, bending down, reaching up, putting myself at risk for potentially losing my balance or just putting myself at increased fatigue? So when thinking about body awareness, thinking about what are those muscle groups that tend to make us weaker? So a big thing with body awareness, when my patients come in and they've told me they've had a recent fall, I go, how did it happen? They go, well, I let my guard down. I wasn't paying attention what happened. I tripped over my rug. I was looking at my phone. I tripped down the stairs. So when you are aware of how your body's operating and where you are in space, that can help you kind of plan ahead and just keep in mind, how do I need to be moving throughout my environment to make sure that I can be as safe as possible. So that kind of goes along with our next slide. So how can we set up our home environment to make sure it can be as safe as possible for us?
And
So-
Allison, I'm just going to interject very quickly and say this. As we're going over this now, so I think we talked about some point at a later date, we want to do a whole program on this. So
Yeah,
that being said, this is our beginning and intro to Allison on the home environment. Thank you.
yeah. So like Nancy said, this is just going to be a brief overview, but we plan on having a future one where we'll go into it in much more detail. But we want to think about our home environment. How can we make it as accessible for us, given what our deficits may be, and how to make it as safe as possible? The first thing I will tell all my myositis patients and any patients across the board, get rid of any throw rugs, especially with that ankle weakness. Especially if you're maybe not having that body awareness. If your foot snags on that rug, that's an instant kind of fall risk right there. But other things we want to think about, having like a first level home setup so you don't have to take those stairs. If you live in an apartment or a condominium, is there an elevator access there? Can you put in any grab bars around your toilet or your walk-in shower so that way you have something to hold on to if you need it? Can you get an ADA height toilet that's already higher up, or can you put something over top of your toilet to lift it up even further to make those transfers easier? Is there a way that you can set up your home so that way everything's kind of at the level that you need it, so you're not bending down low or reaching up real high and putting that balance off kilter? So any of your electronics, appliances, anything like that, can you adjust it so it's going to be easier access for you? And we can move on to the next slide. So how to fall safely.
So, that's $1 million question. But there are some things you can do about it. First off, there was a little message in there that I didn't want to skip. Somebody asked, is it important for me to stretch after exercising? No, not after exercising. It's really not important that you time it that way. I do think that if you think about IBM, it targets very specific muscles that we talked about earlier. What ends up happening over time is the muscles that are opposite those weak muscles get tighter and tighter because they're doing extra work and they don't have an opposing muscle to counterbalance them. So I do think that incorporating some stretching into your exercise is important. And the two main muscle groups that I think it's important to do this with is your hamstrings, which are, the back of your thighs, because the front of your thighs are getting so weak, and also the calf muscles. And if you reference back to one of the earlier slides, I think it was the first slide about exercise, there was a stretch, a gastrocnemius stretch in there. That, basically is like what Ruben's doing up against the wall.
Yeah, this is the one you're stretching.
Yeah.
Your knees straight.
And then for the hamstrings, you can just do it lying on your back. You can just.
Do a long sitting one.
You can, just as he's doing, you can just stretch out that back and maybe lean your trunk forward a little bit, like you're reaching towards your toes. His not very flexible, and you should feel it there in the back of your hamstrings. So those two are probably, I think, the most important things to stretch. Having them stretched out will make it a little bit easier to strengthen the muscles on the other side of those. Is it a good idea to make things easier rather than make the muscles work harder? That's a loaded question. you need to do both, right? You need to make the muscles work harder in regularly scheduled bouts of exercise to get stronger and to optimize your independence. That said, and what Allison was talking about in her point is you can't do that 24 hours of your day or 7 days of your week. So you have to parse it out. You need some things to be tough so that you get stronger, but you need the recovery time, right? And you need the time to get things done safely.
Yeah, kind of going off of that. A lot of times when I give my patients those energy conservation techniques, they say, oh, so I shouldn't be doing things. And it's like, no, no, no. This is how you can do as much as you can, as much as you need to do, as much as you want to do, while still doing it safely. So finding that appropriate challenge for you where you're still kind of challenging yourself and doing as much as you possibly can, but not overdoing it to a point where you're potentially unsafe about it.
So to jump back into how to fall safely, not that I'm bragging, but I've had a few falls myself. And I think when this topic first comes up and when people hear people say, oh, how do you fall safely? I don't. Everything collapses and I'm on the ground before I can think about it. As somebody who has experienced a number of falls, if you keep these principles in mind that we're going to go over, there is that brief moment when you start to fall that you can do what you can do best to protect yourself from having an injury. All right. So if you know you're going to fall, that's okay. But you will have a split second where
I haven't noticed that.
okay, where you'll be able to adapt how you fall to make it a safer landing. Okay.
I think what Quinn is telling us is if you know these basic techniques, I think you can and then try to reflect on this technique. You can kind of like pre-plan it in your head, so that split second, you can react. I guess.
Yeah,
Yeah.
exactly. So let's go ahead to the next slide. And so these, again, these are the main things that you want to keep in mind. Protecting your head is first and foremost, right? The second thing is, yeah, and they'll go through slides to show it more clearly. To turn as you fall, okay? Keeping your arms and legs bent and loose, okay? And rolling out of the impact and spreading out the force. There's a little disclaimer on this slide that falling safe is not an exact science. The safe falling techniques documented above may not prevent injury from occurring, but they can minimize injuries from your fall. And I did see somebody mention something right then and there about a helmet. And we've certainly had some of our patients who have frequent falls who have different types of helmets they wear, even just as simple as a batter's helmet for, a baseball helmet to other forms when they think they might be in a weak position.
Oh, there's a question about a patient that he can't stop once he falls, he just fall. So I guess IBM patient, you can be on the early phase of your disease where you still have enough strength to able to recover from the fall. But if you're like on the later stage, you can only do whatever you can to prevent the fall. So that's why, assistive device and some of the bracing that we'll be discussing later on may help you, recover much better.
Yeah. But the main thing about this little segment about falling safely is the two things that we don't want to have happen when we fall are a broken bone or a bleed inside our heads, right? Because those are the two most damaging things and the things that are going to have a huge impact for months to come. So that's really the point of these next few slides is what would be the best ways to make sure you don't break a bone you don't hit your head hard enough to have a head bleed.
This one is protect your head. So I guess the most important thing you need to consider when you start falling is to really protect your head. You know, you don't want to have like hit your head and have a brain bleed. So you do that by try to tuck your chin down to lower, you know, as you go down, and that will help you stabilize rather than your head going back and forth when you hit the ground. Tuck your chin down and protect your head by putting your arms forward if you're falling forward,
Right.
or if you're going backwards, you really have to tuck your chin and put your hands behind your head. And as you fall, try to turn so that you don't hit the ground on the back of your head or front face. So turn. So you want to land on the meaty part of your body, on your butt or on the shoulder area.
And by tucking your head, that kind of helps prevent almost that whiplash
The whiplash,
kind of
yeah.
injury
Yeah.
as you fall down and hit into the pavement.
Especially those patients who are taking what you call it, blood thinners. You know, you're if you fall, you're more likely to bleed. So you really have to be very careful. Next slide, please. So this is the one where turn as you fall. As I said before, when you start falling, try to turn your body, but don't land frontward or backward. Turn your body so that you land on the meaty part of your body, on the shoulder area here or in the back, so that you may minimize the impact from the fall.
The next one.
Slides, yeah.
Yeah, and so, I think the other thing, so the first couple are to try to avoid really hitting your head hard and causing possibly some kind of intracranial bleed. But the other thing is you really just don't want to break your wrists or your elbows and that kind of stuff. So the way that they're going to get broken is if you're outstretched limbs that are trying to stop you. So let yourself go. Keep those arms and legs soft as you go down. You're much less likely to fracture a bone when you do it like that. And as much as you can, stay loose. Falling is a very scary thing for any of us who fall. But as much as you can, just go limp and let it happen, because it's gonna. You're just really not going to have, you're much less likely to have any kind of serious injury from the fall, the looser you are during that fall.
Okay. And when you are falling, try to let yourself roll out of the impact. This guy kind of looks like he's doing a full-on somersault. You don't have to do that. Just don't try to abruptly stop yourself, because that's going to create more force, which could lead to more injuries. Rather, kind of let the force take you just into a roll, so that way your body can absorb that impact. And the next one, spread out the force of your fall. So kind of thinking about with those arms extended, think you're only hitting right here. That means that wrist is taking all of that pressure of your entire body. That's going to cause more injuries, lead to bone breaking, things like that. So you want to try and dissipate that impact by kind of how Ruben was saying, landing on those larger parts of your body. So that way it's not going to cause as much injury. It's going to spread out that force and try to reduce that risk of injury.
So what are the options for equipment to prevent a fall? So for the next two slides, so here on these slides, these are the ground reaction AFO that we typically recommends for those IBM patient who has a recurrent knee buckling. However, we found that those IBM patients on the earlier phase of their disease to the middle part, where they still have enough strength so that when their knee buckles, they can still recover and use that muscle to extend their leg. So that's the patients that are good candidate for this ground reaction AFO. However, if you are on a stage where your leg is so weak that you could hardly, like extend your leg to like 45 degrees or 60 degrees, you may not have enough strength to recover when your knee buckles, that this brace won't even, prevent you from buckling at all. So, and another thing is, if you decides to get this one, you just don't get this off the shelf. We usually recommend that you see a certified orthotist. That's a person that specializes, measures you evaluate you for this brace, measures you and then fabricate the brace for you. It's a customized thing. So here in the Myositis Center, those people that come here, we usually ask the doctor to write them a referral to see a certified orthotist in their local area, and then we usually give the Autobac is a pretty good brand name for it. This is a carbon fiber AFO, so it's light and durable. So that's the one that we normally recommend.
Not to endorse
Not to
a
endorse
particular
that, yeah.
brand, because we get no kickbacks.
Yeah.
But it's just, I think it's one that a lot of people are familiar with.
Okay. And this kind of brace, I think most people are familiar with this one. This is the AFO, ankle foot orthosis. And this is for those, please repeat. It's called orthotist. So it's spelled as ORTHOTIST, ortho, like the ortho, and then tist, TIST. Anyway, this AFO is indicated for those people that are have a foot trap. So it's basically holds your foot, and as you can see, the brace is holding it up. So when you swing your foot when you walk, it doesn't hit the ground, and you don't trip. And again, Autobac has a good type of this brace. Is also like a carbon fiber brace. What?
There's a comment.
Okay, and then preventing a fall by use of assisted device. So we had a couple questions like, is it worth me walking if I'm using an assisted device like a walker? Yes, absolutely. We want you to use those devices that you need to keep you safe, but still keep you moving. So we have just like a standard rolling walker on the far left. There's a quad cane and a regular single point cane. The quad cane will give you a little bit more stability, single point cane a little less so, but a lot of times those are going to be kind of like the beginnings of your assistive devices. I even have some patients with IBM, because they know that they are at higher risk for falls. They will just carry a simple single point cane when they go out in public. So that way, if they happen to have a fall, that's kind of giving like a little flag saying, I have what can be kind of an invisible disability. I might need some help getting up. We also have the rollators. We have just that regular rollator in the middle that's blue, but also a platform rollator where you can kind of rest your forearms right in there to give you a little bit more support and upright. And then on the far right, there's an easy step stair climbing cane. So it's actually similar to a quad cane, but there's a little kind of like a half step included in the cane. So that way it kind of cuts the steps that you are doing in half. And it's pretty lightweight, but you just take that with you. So it makes those steps a little easier. And the next slide. Unless you guys had any more comments?
No.
Okay. So over here is kind of different things that can help with different transfers. Now, in future, we'll probably go into these in a bit more detail, but just to kind of do an overview, there are simple chair boosters that you see in the top left. I think we have one here that I think is Caboost brand. Yeah. Yep, no problem. So just a little thing like that. It goes under the four legs of your chair.
It's lightweight, it's plastic, it's good for about 350 pounds, and it raises your chair anywhere from one side is 2 inches, the other side is 3 inches. And these are spring-loaded legs, so it fits different size chairs.
Now, a pretty low tech option that a lot of my patients have been using and that I recommend to a lot of patients is just having an extra thick seat cushion. Those are pretty simple. You can find those at different like Lowe's, Home Depot. You can find in stores like that, and then even make like little carrying cases. So that way, if you're going out to the restaurant and you're concerned about what their seating might be, that's something that fairly easily you can take along with you. So you're not as concerned coming to stand in public spaces. We kind of talked about that raised toilet seat with handles for the home. But kind of going off of that, there is the free to go rollator. So it works similar to the rollator we had on our previous slide. But this one, instead of having a little basket, when you lift up the regular seat, there's actually a toilet seat on there. So I know going into public restrooms is often or can often be a cause of concern, because even if you go into the handicap stall and you have those grab bars handy, the toilet seats do tend to be on the lower side. So this gives you an option. So that way you're going to have a raised and lifted toilet seat. So that way transfers to and from the toilets, especially in public, will be a little safer and a little easier. And actually, because this is a women with IBM group, if toilet transfers in public is something that you are concerned about, we have even recommended the female urinals, like the little kind of cone, little funnel pieces. If you feel unsafe sitting at a toilet and standing back up in public, that can also be an option as well. I included this mechanical toilet lift on here. There are options out there. The biggest thing you need to consider if you are looking into a mechanical lift is that it is going to take you up and not just kind of flip you forward. Because of that quad weakness, if you're just getting pushed forward, you can be high risk of your legs just kind of crumbling, which a lot of lifts out there do just kind of do the forward push, which is not what you want to look for. You want to look for something that's going to raise your bottom up and give you just a higher surface to stand from. So the lifting seat that's down in that bottom corner, we have had patients who have used those with good success, but you do want to consider, is it just going to push you forward? Is it going to kind of spring you out and you don't have the control? So it's going to be kind of a person by person kind of option. Now the Hoyer lift and the Beasy board, those are for our more advanced disease processes. So those are things, if it is too difficult for you to stand at all, these are options. The Beasy board is just a sliding board, so you can get from one surface to other, just kind of scooting yourself over versus coming to a full stand. And then the Hoyer lift is for more advanced when you're more like in the wheelchair and need more assistance, need that caregiver support. Okay, next slide. Okay, so we have just a couple different sites on here that give you more information about falls and falls prevention. I know at least I'll probably be talking about it in another talk, but the National Resource Center on Supportive Housing and Home Modifications, if you go to that website, it gives you more information about where you can find different options like that. The cdc.gov/steady really focuses on how we can prevent falls. This talks specifically with, I think, older adult populations, but really anyone who's at risk for a fall would benefit from their information.
Okay, and there are just some more references, and that's what we have for you for tonight.
So Ruben, Finn, Allison, I can't thank you on behalf of the women with myositis, women with IBM. I can't thank you enough for taking us back to talk about this topic that I think is important to all of us, whether we have IBM or we don't have IBM, as we're on our journey within life. And as we started this, we initially thought that it was going to be a one-time shot, but after meeting with Ruben, Finn, and Allison, we realized we need more time. So that being said, our next meeting, which is going to be, you will see in our next meeting, which is going to be July 18th, from noon to 1:30 Eastern Time. It's going to be Fall Prevention Part 2. What we're going to be talking about, just to continue, is today we talked about some exercises that will help strengthen us so that we can prevent falls, how to fall. But now we need to know how to get back up. So we're going to be talking about our fall recovery and more about equipment and devices to protect us from falls. And that's going to be July 18th from 12 to 1:30 Eastern Time for all of you that are throughout the US and Canada. So I'm in awe. Ruben, Ben, Allison, thank you. And I know there still are a lot of questions. I am going to say to all of you, if you have more questions, if there are things that we did not cover today, please, please, please send us an email and communicate. This recording will be available on the TMA YouTube website. I'm not sure exactly how long Rachel takes till she puts it up, but it will be on there soon. So let's just go back quickly and see if there are, I can't say thank you to everybody is where we are right now. So let's see, everybody
Thank
give
you
a
so
big
very
shout
much.
out to Ruben, Finn, and Allison, and the Johns Hopkins Baby Rehab Center and the Myositis Center, which keeps us all going and moving for part 1. So now we get to go to part 2. Also, another quick thing for those of you that are not aware, I wanted to let everyone know that the TMA 2023 International Annual Patient Conference registration is open. It's going to be held in person this year in San Diego, California, and it's from September 7th through September 10th. We have hands, yes, so much great information. Gentlemen, do you have any closing remarks other than we can't thank you enough? Allison?
One thing, people were asking about arm exercises. We didn't
Yes.
focus on those so much because they don't play as big of a role in fall prevention. But I would say like the quadriceps exercises that Finn and Ruben went over that are really making your arms go into that extension and working on those arm extensors. Those I would think would be the most helpful, especially in especially if you are at the stage where you're using an assistive device, that'll give you the most support and stability with that.
So with,
Mhm.
yes,
I was going to say, other than that, thank you very much for inviting us to.
well, we're thrilled and we're so excited to have you come back. And I can't reiterate to everyone, please send us your comments. Let us know what you want to hear from our experts next month so that we can continue doing this. And Ruben, Finn, and Allison, it's been too long since we've been in touch with you. And we're going to say thank you again for doing this at the end of your work day. Again, our upcoming event, and we're also just going to say, remember, IBM is a generally slowly progressing disease. and we have time to adapt. We have to accept our condition, exercise with care, keep a positive attitude and smile, and share our good news. It may be just what someone needs to hear. You are a super warrior. So a huge shout out again for the Women with IBM team. Thank you everyone for joining us tonight, and we will see you on July 18th for part 2, and please hear from you before then with any questions or any comments. So with that, good night or good afternoon to those that are on the West Coast. Thank you all.
Bye-bye.
Bye-bye.
Thank you.